Dermatology and Cosmetic Surgery is your one-stop shop for all things skincare. Joining us now with more is Dr. Lee Grafton. Good morning.
Morning.
So tell us, what are some of the common skin ailments you see?
One of the things we see a lot more of is skin cancer. We kind of have an aging population out there. Their immune system isn't working quite as well to get out there and get those little precancers when they appear. So more and more skin cancer nowadays. We try to teach people to be alert, avoid the sun during the active periods of time, 10 to 4, and also wear good sunscreen. Then of course we see a lot of pediatric conditions such as warts, atopic dermatitis, which is a lot of people know as eczema. Those are very common. And there's literally hundreds of things that we see on a day-to-day basis that are skin conditions.
And tell us about Mohs micrographic surgery.
Mohs micrographic surgery was invented by a fellow named Dr. Frederick Mohs, who's actually a general surgeon, and it's where you actually process the tissue. Once you take a skin cancer out, you check all the edges and the base to make sure that you got it all. If you don't, you know exactly where to take a little bit more, so it allows you to conserve as much tissue as possible and get that skin cancer out and repair it on the same day.
So tell us about SRT.
SRT is superficial radiation therapy, and it's fairly new. It allows us to treat small and medium-sized skin cancers with very little scarring or side effects whatsoever. We do have that available in the home office, and it's great for people that are over the age of 60 to 65 who don't want to go through the downtime of surgery. So it's a great alternative to surgical removal of skin cancers.
So you offer some items for sun protection.
That's correct. We have sunglasses here. We have Maui Gem sunglasses, also Costa Del Mar. They're great for protecting your eyes. We also have, for guys and women both, we have several varieties of sunscreen. A lot of guys complain that they put their sunscreen on and it's too sticky. We have powdered sunscreens. We have sunscreens that you can't even tell that you put on that are up to an SPF of 50 or 60. So if you're looking for that sunscreen for your face, come by and check us out.
So how often should people come in for an annual skin checkup, would you say?
A lot of it depends on family history and age. If you have a strong family history of skin cancer, you know, mother or father, we'll have you come in once a year. But also, a lot of people, after the age of 40 to 50, they'll start coming in once a year, because after 50, your chances of getting a skin cancer really go up. Also, if they have a personal history of skin cancer, it's once a year given, and often it's fairly frequently. As soon as we've taken the skin cancer out, it'll be once every 6 months for a year or so, then once a year. So generally once a year, once every year to 2 years.
Okay, and more on the fun topics now. So you're quite the avid outdoorsman and fisherman.
Oh yeah, we do a outdoor TV show called Keep On Casting. I originally started fishing 19 years ago, and we started Keep On Casting. We've been doing that for almost 2 years now, and we've got a wide viewership in South Louisiana and actually other states also. We enjoy getting out there and fishing and enjoying the South Louisiana way of life, and we also have Cajun cooking on there, so y'all check it out.
A lot of fun. All right, thank you, Doctor. We're joined now by Dr. Crystal Guidros. Crystal, so tell us, I mean, if we have any unusual skin pigmentations or discolorations, it's better to be safe than sorry, right?
Yes, definitely best to come in for any new growth, especially a new dark spot. In regards to existing moles, if there are any changes in color, size, or shape, or any symptoms such as bleeding or itching, it can be concerning and should definitely not be ignored.
All right, and on your website, you list several different procedures with using lasers and so forth. Can you describe a few for our viewers?
Yes, we have several lasers. Some of our most popular would be our Intense Pulse Light, or IPL, which is a great photo rejuvenation. It's good to treat discolored areas or brown spots, as well as for patients with rosacea who may have some red discoloration or small broken blood vessels. We also have our laser hair removal, which is great for unwanted hairs almost in any area of the body. We also have a vascular laser for any red birthmarks or any other vascular lesions, as well as our tattoo removal.
Wonderful. Thank you so much. For more information, visit graftonderm.com, and for appointments, call 985-876-5000, or you can visit one of their offices in Houma, Thibodaux, Morgan City, and Raceland.